I just want to begin by welcoming everyone to Medicare Mysteries with Michelle Magarian. My name is Kim Murphy. I'm a marketing specialist for Riverwoods Manchester. This event, hopefully provides some helpful information on questions, and it's based on questions that we receive from residents and families pretty often. So as we get started, there's just a few housekeeping notes that I will share with you. If you want to go ahead and advance the slide, Michelle. Like every webinar, you're all on mute, but we do welcome your questions, and you can submit those in the Q&A function at the bottom of your screen at any time throughout the presentation. We'll answer those at the end. This workshop is being recorded, and a link to the recording will be sent to you in a few days. You can look for that in your email. We always welcome suggestions on how to improve. And as I mentioned, the goal of our workshops is always to provide helpful information, and they're often based on topics that we receive questions about. So if you have an idea, please share that with us and let us know. Some of you may be familiar with the Riverwoods group, but if you're not, we are the largest independent group of not-for-profit continuing care retirement communities in northern New England. Our communities consist of 3 campuses. Riverwoods Exeter is our flagship community, which consists of 3 campuses, the Woods, the Ridge, and the Boulders. Riverwoods Manchester, which you may be familiar with as Birch Hill, affiliated with the group in 2016. We announced our official name change to Riverwoods Manchester last Wednesday, and it's been an ongoing celebration, and we all hope that you'll help us spread the word. And Riverwoods Durham affiliated or was opened in 2019, late in 2019. So you may be asking, what is a CCRC? Beyond the lovely community that you just saw pictured there, we are an insurance product, and our contracts are regulated by the state of New Hampshire. Our financial performance is also reported to the state every year. You're prepaying and insuring for your assisted living and nursing needs as an insurance product. And because of that, a portion of the entrance fee and the monthly service fee are tax deductible. But beyond being an insurance product, it's also a lifestyle choice or a choice of optimism. We welcome independent adults ages 62 or better who want to live the life doing more of the things that they love and free themselves from the burden of home maintenance and chores. The amenities and services in our communities include transportation, a full calendar of activities, fitness classes, lectures, clubs, education opportunities, which, all lead to increased social options. But most importantly, in some people's minds, it's the opportunity to stay in control of your life. And what I mean by that is a continuing care retirement community answers the questions of where your healthcare will be provided, who's going to provide that care, and how much the care is going to cost. You're not leaving anything up to chance, and you're not burdening your family members or loved ones with making a decision for you in a crisis situation. And if you'd like some more information about all of our communities, there's a slide at the end with some contact information to learn more. But today's presentation is featuring Michelle Magarian of ServiceLink. She has been educating and advocating for families and beneficiaries for over 18 years. And she has a certification with the State Insurance Assistance Counselor as a certified State Insurance Assistance Counselor. That's a mouthful. So, Michelle, I'll turn the presentation over to you.
Okay.
Like I said, if you have any questions, please feel free to enter them at any time in the Q&A function.
Well, thank you all for joining this afternoon. And thank you, Kim, for asking me to speak this afternoon as well. For those of you, again, my name is Michelle Magarian. I am the Medicare Coordinator for our Hillsborough County Service Link office. I have been, as Kim said, doing Medicare counseling for 18 years now. And I've been here at the Hillsborough County Service Link for 14 of my 18 years. I started as an intern in college, and they were looking for somebody who wanted to learn the health and human service field and the aspect. And before going into health and human services, I thought I wanted to be a nurse when I grew up. So I've always worked with seniors and adults with disabilities. So I thought this was a great opportunity for me. And today I'm still obviously thinking it's a good opportunity for me because I've been doing this for this long. I am a certified SHIP counselor with CMS, the Center of Medicare and Medicaid Services. And I'm also a certified information and referral counselor for the aging and disability population. ServiceLink, what is ServiceLink? ServiceLink is an information and referral agency. We were established in 2000. We have 13 locally based resource centers throughout the state of New Hampshire. We are a nonprofit agency. Our funds come in from the federal government through CMS down to the state of New Hampshire to the ServiceLink office. ServiceLink is specific to New Hampshire. We are New Hampshire's ADRC, which is the Aging and Disability Resource Center. And we are a confidentiality-driven program. So when you call us, your information goes no further than to myself and my coworkers if I need to discuss your situation further. We partner in 2003, we formed a partnership with UNH Cooperative Extension and the Department of Health and Human Services, the Bureau of Elderly and Adult Services. Prior to COVID, we had someone from the state of New Hampshire who would come in to the office once a week to help us to do some of the different programs that the state offers. Again, we're a federally funded program through the Administration on Aging and CMS. At ServiceLink, we have, again, I said that we offer free and confidentiality. We provide one-on-one services and assessment needs. At this particular time, due to COVID, we can either do it through Zoom or over the phone. Unfortunately, at this time, we're not all completely vaccinated, so we do not do any face-to-face appointments. Who works at ServiceLink? We have our center manager. We have an options counselor, our caregiver specialist, and Medicare specialist as well. So we do a vast amount of services in the community. So our options counselor provides information regarding long-term support plans. You're potentially wanting to move your mom or dad from New Hampshire to another state or from another state back to New Hampshire because that's where their original roots were. How do you do it? What do I need to do? Your mom or your dad or your husband or wife or whoever might potentially be declining in health, and you want services brought into the home. What kind of services are available? How can you get those services? And if need be, then how to transition from the community into a long-term care setting? And is it going to be paid privately, or do you need to pay through the state Medicaid process? And our options counselor would help to navigate that. Unfortunately, we do not know what long-term care facilities have for availability. So individuals, we often say, will need to go out and educate themselves about where they would potentially want to go if that ever needed to happen. We have a caregiver specialist who helps individuals with the caregiver respite grant, and also the the grandparent respite grant. Today, we find a lot of grandparents are caring for their grandchildren. So the caregivers themselves sometimes just need some time and space, or potentially even maybe need to go out and do something for themselves, get their hair done. Maybe their niece or nephew is getting married out of state. How to get the monies to be able to give you that necessary respite. At this particular time, so the respite grant goes from July to June, so fiscally year. So at this particular time, we're coming toward the end of our fiscal year, and individuals who would need any type of respite grant money in regards to the family caregiver respite, they would need to be put on a waiting list. Then there's myself. I am the Medicare specialist coordinator. I help individuals to navigate the complexities of the Medicare system. Unfortunately, the law prohibits me from telling individuals what to take. Also, I cannot tell individuals if a procedure or process would be covered, because if you call 1-800-Medicare, they unfortunately can't tell you that either. And so I can't tell you if something is going to be a covered service by Medicare or not, and nor can I tell you what plans to take. The law does prohibit me from doing that. None of us at ServiceLink are licensed insurance agents, so therefore it does prohibit us from being able to direct you on take this plan or that plan. So every individual that works at ServiceLink must be a state health insurance assistance program counselor. So we all are certified by CMS to be able to offer the services in regards to counseling about the Medicare program. If individuals are already on Medicare, or your mom or your dad potentially is, if you turn over your Medicare and U-Book, our phone number is right on the back. Oftentimes I will get, people will call and they'll say, you're like the third or fourth person that I've called. And, and I'll say, well, do you have your Medicare book? And they'll say, yeah, it's right here. We'll turn it over because our phone number is right on the back. So next time I'll be the first person you call in regards to your Medicare questions or concerns. So again, people don't know that we're readily available. We do answer the phone when we're available Monday through Friday. All of our offices are open 8:30 to 4:30. By state contract, we have to give individuals a contact back within 48 hours of receiving the call. Unless you call at 5 o'clock on a Friday, you would receive a call back our following business day, which would be Monday. So this is what the Medicare card looks like today. It has your name, your Medicare identification number, your effective dates for your Part A and your Part B. If anyone has been on Medicare or their parents were on Medicare in the past, they used to have your Medicare number was your Social Security number followed by a letter. So if you were drawing off of your own benefit, it had an A. If you were drawing off of someone else's benefit, it would have a different letter, a B, a D, a W, whatever your thing was. And you also had a signature line. They have taken off that signature line because the card is paper. And so when people get their Medicare card, they're like, is this it? Yes, this is it. It is a paper card. That is your Medicare card. Yes, you can laminate it now because it does not have a signature line on it. So that's why they made it where they took the signature line off of it. And also for security reasons, they took off the Social Security numbers and just gave the Medicare identification numbers now. So Medicare is run by the federal government. Oftentimes people will call us and they're confused because they have Medicare or Medicaid. One's a federal program, one's a state program. And oftentimes what I'll get sometimes like, I don't know what I have, Medicare, Medicaid, why did they give it the same close name? The answer is, I don't know, but one's a federal program, one's a state program. Original Medicare is what they refer to as this card right here that you're looking at. That will provide your Part A and your Part B coverage. So you'll see on the card, it says Part A, hospital, and then Part B, medical. So that is your A is your hospitalization, everything that happens on an inpatient basis. B is everything that happens on an outpatient basis. So going to the doctors or the hospitals, and you can go to any doctor that accepts Medicare or any hospital that accepts Medicare. So we're going to talk a little bit about the enrollment process into the Medicare and Part A and Part B. So as long as you have worked your 40 quarters, there's no premium for your Medicare Part A. If you did not work your 40 quarters, it would depend on how many quarters that you worked would be on how much you pay for a premium. Most individuals have worked their 40 quarters, which is 10 years. So that's usually not an issue. But if it is, it's not a standard fee for one person or to the other, because it really depends on what your amount of quarters that you did use to make it where how much you would potentially have to pay for your benefits. You also may be able to draw off of your spouse's benefits as long as they have worked enough quarters in their life. Medicare Part B does have a premium, and your Part B premium is assessed off of your gross income. So the Social Security makes the determination on how your taxes that you filed from the last 2 years. So that's oftentimes what people will say, well, today I'm retired and my income is not as high as it was 2 years ago, but the Social Security office does do the assessment from 2 years ago. So today, if they were looking at your Medicare Part B premium, they would be looking at your 2019 taxes to determine on what your premium cost for your Medicare Part B would be. And individuals do have the ability to appeal it if they feel that it's too much and they're not going to be able to afford it now that their income has decreased due to the fact that they're no longer working. And one of the questions that I get frequently is that, do I have to take Medicare Part A or Part B if I am still working or my significant other is still working and has viable coverage? That's the most important thing, is the viable coverage. So if your employer has more than 20 employees and you're over the age of 65 and you're covered by your employer's benefits or your spouse's benefits, the answer is no. You do not have to take Medicare Part A or Part B. Oftentimes people will take the Part A and decline the Part B because that is what you pay for. There is no penalty if you do not take your Medicare when you're first eligible. Upon retirement, upon losing of the loss of coverage, you would then have to have your employer or their employer fill out information that indeed you've had viable coverage for the time that you did not take your Medicare. So again, Medicare has what they refer to as Medicare Part A, which is your hospital benefit, and Medicare Part B is the outpatient benefit. Your Medicare coverage starts on the first day of the month that you turn 65. So if your birthday is April 25th, your Medicare would start on April 1st. If your birthday is April 1st, your Medicare starts on May 1st. It's the month prior. So you must be 65 or disabled in order to qualify for Medicare. If you've been disabled for 24 months, the 25th month, you're automatically enrolled into your Medicare Part A and Part B benefits. The Medicare Part A covers things such as hospital care, hospice, skilled nursing, blood. So that is what the programs under your Medicare would cover. When it comes to skilled nursing, they do not cover custodial or long-term care. So it would be skilled up to 100 days of your skilled or rehabilitation services. You do not pay, again, the monthly premium if you or your spouse paid Medicare taxes within the 40 quarters. So under Medicare Part A, if we were only looking at, that's all you had was original Medicare, the Part A and Part B benefit. So there is a deductible under your Medicare program. The deductible for 2021 is $1,484 for a hospitalization. So with Medicare Part A, they refer to things as a benefit period. So that benefit period renews itself every 60 days. So every 60 days, that $1,484 deductible would renew itself. So if you went into the hospital today, for example, and you got out on Saturday and you went back in the hospital in 40 days, you'd still be underneath that deductible period. But if you went back in the hospital in 70 days, you'd have a new $1,484. And so if I go back to, you were in the hospital for from now, Saturday, then you go back in the hospital in 40 days, you start back at that particular day. So if you've already been in the hospital for 4 days, you're going to start at day 5, according to that. Oops. I didn't mean to do that. So they're going to put it at day 5 of your benefit. And you would then go from there about the coverage and how the coverage worked. The Medicare Part A also covers your skilled nursing benefit. Your skilled nursing charge for 2021 is $184.50 per day after your first 20 days. So Medicare covers the first 20 days, 100%. After that, day 21 through 100 does have a copay amount attached with it. I'm not sure if we have any questions in the chat, if people want to ask questions at the end of every part of Medicare, or if we want to continue. Do we have any questions, Kim?
We do have a few questions. So I'll just, let me see here. Anything pertaining to the first couple of sections here. So does ServiceLink monitor the cost for long-term care facilities in New Hampshire? This pertains to the ServiceLink, services that you provide.
So when it comes to the long-term cares, it depends on the particular facility. So we do have an idea of roughly how much it does cost, but the cost of a nursing facility can vary from person to person on whether you are private pay or you are under the Medicaid program.
Okay. Let's see. If you have a plan or if you have or plan to have a health savings account, do you need to decline Medicare A and B? Or are you liable for taxes on the HSA contributions?
So the answer to that is yes, you do have to decline the Medicare Part A and B if you have an HSA account, and you need to stop contributing to your HSA account 6 months prior to your knowing that you're going to be taking your Medicare benefits.
Okay. That's it for now.
Okay, perfect. So then there is Medicare Part B, which is your services, everything that happens on an outpatient basis. So preventative services, health care, and that direct to, so they're trying to make sure. In 2011, when the ACA, the Affordable Care Act, came into existence, is when they really ramped up the information regarding the preventative benefits. In 1965, when Medicare came into existence, they said, this is your benefits, your Part A, your Part B, and that's what you get. When in 2011, when the ACA came into effect, they said, we need to help individuals to stay healthier, to keep down the cost of our Medicare, to keep people out of the hospital, keep people out of the doctors. Like, how can we help them to stay healthy? And so they increased the preventative benefits. So like smoke and cessation, BMI testing, nutritions, things of that nature, to help individuals to stay as healthy as possible. Medicare Part A or Part B does not cover dental, vision, or hearing when you're talking about the original Medicare. So that is one question that we get quite frequently. Then what would I do about that? We can talk about that further in a little bit. So you do pay your monthly Part B premium, and the monthly Part B premium does go off of your gross incomes that you did from 2 years ago. So this is the cost of the Medicare Part B. So the average person, if you're single and your income is less than $88,000, then your premium would be $148.50. If you're a married couple and your income is less than $176,000, then your premium would be $148.50. If your income is more than that, then here's roughly a chart about how much your premium would be during on a monthly basis. Medicare, the big difference between Medicare Part A and Part B is that with Medicare Part A, you have that benefit period in regards to your deductible, where with Medicare Part B, they have an annual deductible. This year's annual deductible is $203. And then Medicare pays 80%, you pay 20% of the Medicare approved amounts after your deductible is met. So you would pay the first $203, and then Medicare would pay 80, you would pay 20. There is financial assistance to pay the Medicare Part B, A or B premium if so needed. It's called the Medicare Savings Program. Oftentimes individuals refer to it as QMB or SLMB. So with QMB, which is the Qualified Medicare Beneficiary Program, that one pays your monthly premium, your co-pays, deductibles, and co-insurance. The SLMB program, there's two SLMB programs, the SLMB 120 and SLMB 135. With the SLMB 120, you can have Medicaid, and it only pays your Medicare Part B premium. With SLMB 135, you cannot have Medicaid. It also would pay your Medicare Part B premium. So these are the income guidelines. Both of the programs are income and asset driven. So if your income is $1,094 or less, if you're an individual, and you have less than $7,970 in resources, then you could potentially qualify for this program. Oftentimes people will tell me that they're not going to take their Medicare Part B they're not going to take their Part B benefit because they can't afford it. Well, I can understand that you can't afford it, but there is financial assistance for individuals who can't afford it. Because if you do not take your Medicare Part B when you're first eligible for it, so they have, with Medicare, they have the initial enrollment period, which is when 3 months prior to your 65th birthday, the month of and 3 months after, is when you have the ability to enroll with your Medicare. If you, for some reason, think that Medicare was going to notify you and tell you that you're going to be 65 and they know you're going to be 65, you're sadly mistaken, because that doesn't happen unless you're already receiving some kind of Social Security benefit. If you're receiving a Social Security benefit, then yes, it would notify you that your Medicare is going to start, and even potentially send you a card. Or if you're disabled and your 25th month is coming up, then you would get a Medicare card for that as well. If you do not take Medicare when you're first eligible, there is a 10% penalty for every year you do not have a Medicare plan in place. And if you do not have what we referred to earlier as viable coverage, so insurance through yourself or your significant other's employer's benefits, then you could be subject to that 10% penalty. You would also then have to wait until what they refer to as the general enrollment period. The general enrollment period is January 1st to March 31st, and your benefits would not start until July 1st. So not only do you get the penalty, you have to wait the several months before your Medicare Part A or B would kick in if that was the case. And it's not a one-time penalty. It is a penalty for the rest of your life. So unfortunately, you want to make sure that if you or your spouse is not covered, then you enroll with the Medicare Part B, because that is the one that's very important that you sign up for to make sure that you don't accrue any type of penalty. So Medicare Part D, which is your prescription plans, that again, you're eligible for your Medicare Part D, which is your drug benefit 3 months prior to your 65th birthday, the month of, and 3 months after. That is the general enrollment period, or I'm sorry, your initial enrollment period for that. And then you can change plans every year. So what I say to people is, don't get too comfortable in your prescription drug plan, because most of the time every year the plans come and go, their premiums go up or go down, deductibles change, medications come on and off the formulary. So during the open enrollment period, October 15th to December 7th, every year you have an opportunity to look at plans to change for the following year, and it would be effective for January 1st. If an individual qualifies for what they refer to as extra help, also known as low income subsidy, where they have both Medicare and Medicaid, they can change their plan at any time throughout the year, 4 times a year. So they do it once a quarter is when you can change your plan. Before, it used to be every month, and sometimes it was just a lot for individuals to be changing them that frequently. So now they changed it to only once a quarter that you have the ability. If you lose your coverage, so with earlier I had referred to with Medicare Part A and Part B as viable coverage, so that has to be active employment. When it comes to Medicare Part D, it has to be creditable. So that means equal to or better than what Medicare has to offer. So either it's through a retirement plan, through your VA, something of that nature, that you have prescription drug coverage. You do not have to take a Medicare Part D plan if you have VA benefits. That's oftentimes that people will ask, well, do I have to have Medicare Part D if I have a VA? The answer is no. Sometimes people will take it because of the fact if a medication for some reason might not be covered by the VA, or they need it immediately and they can't wait for the mail to come in. Whatever the circumstances are, they might take an inexpensive plan just so they have one through Medicare if an emergency was to happen. If you're covered by your employer's plan and it has drug coverage attached with it, you cannot take a Medicare Part D plan because you have already have prescription coverage. If you do not take a Medicare Part D plan when you're first eligible, there is a penalty for that as well. There is a 1% penalty for every month that you do not have a plan in place. That as well is not a one-time penalty. That is a penalty for the rest of your life. So in 2006, when Medicare first came out with the Medicare Part D plans, people weren't very happy because the government was telling them what to do. and they didn't like the fact that the government was telling them what to do, that they had to have a prescription plan or they would have a penalty. Today, Medicare Part D is welcomed by many, many individuals, much more than it was in 2006 when I'd be presenting about the prescription plans being new. It wasn't received well because they were being told what they had to do. And the plans were structured a lot differently than what they are today in regards to when you met a certain criteria or coverage area. What you pay, you pay a monthly premium. Most of the time there's a yearly deductible, your co-payments for your prescriptions. And then depending on what your prescriptions are, there is what they refer to as the coverage gap, or also known as the donut hole. These are all of the plans that are currently available in the state of New Hampshire. The cheapest plan at this particular time is $7.10, and that is with SilverScript Smart RX. So people will often ask, well, if I don't take any medications, then why do I need to take a Part D plan? Well, again, if you don't have a Part D plan and you need something in the future, you'd be subject to that penalty. So most of the time, if people don't take any medications, they will take that $7.10 plan. And then during the open enrollment, they'll look to see what might be the next cheapest plan and go from there. That particular plan does have a $445 deductible that you must meet before your coverage starts. But oftentimes when it comes to the deductible, it really depends on the level of the prescription that you're getting, the tier, if you will. So if it's a tier 1 or tier 2 medication, which is your generics, preferred and non-preferred, would determine on if you have to pay that deductible or not. There is financial assistance for the low income subsidy, which is also known as Extra Help. That is an income and asset driven program as well. It helps pay the monthly premium, the deductible, and keeps your co-payments at a smaller cost than what individuals would have to pay if they didn't receive the financial assistance. I'm going to stop there and see if anyone has any questions at this time.
Okay, there are a few more questions that came in. Not to circle back too much, but let's see. Can you explain the deductibles, not the amount? Is the deductible the patient's responsibility?
Yes. So as far as the deductibles go, those are your responsibility before Medicare will kick in. So your Medicare Part A deductible of the $1,484, that's what you would be responsible for before Medicare would pay their allowable amount. And as far as the Part B deductible, then the Part B deductible is $203. Then Medicare pays 80%, you pay 20% of Medicare approved rates.
Okay. And then a question about ServiceLink. What does it cost to use your services?
We are a free and confidential service.
Okay, great. Let's see. If I turn 65 on January 2nd, am I eligible for Medicare on January 1st?
Yes.
12/1 of the previous year.
Nope, January 1st. So the only time it truncates to the previous month is if your birthday is the first day of the month. So if your birthday is January 2nd, then it would start January 1st.
Okay, great. All right, that's it for now.
Okay, then we'll go on. So we went over the Medicare Part A and Part B and Part D components of Medicare. So those are the basic things that individuals oftentimes will look at. Then they have what they refer to as Medigap, fills in the gaps that Medicare doesn't cover, also known as supplement insurance. So supplement is sold by private companies to help pay for the healthcare gaps that Medicare doesn't cover. So again, the deductibles and the the coinsurance for various services. In the state of New Hampshire, we have the ABCs of supplement insurance. If you live in Massachusetts, Wisconsin, or Minnesota, they don't do ABCs, they do gold, bronze, silver. They're the only three states in the nation that do it differently than everyone else. Plan C and Plan F are no longer available unless you were eligible for Medicare Part A prior to January 1st, 2020. So individuals do not have an opportunity to shop for Plan C or F unless you were eligible prior to the January 1st. These are how the Medicare, so we have A, B, D, G, K, L, M, and N. Again, C and F is no longer available unless you were eligible prior to the January 1st of 2020. The most comprehensive plan at this particular time is Plan G. Plan G has a regular Plan G, which pays everything minus your Medicare Part B deductible. There is also, you'll see the little asterisk after the G. There is a high deductible Plan G as well. The deductible at this time is a little over $2,300 is what you would be responsible for before the Plan G would kick in. So really depends on what your needs are economically, what you're looking for and what you can afford. When it comes to supplement insurance, if you were to call us in regards to looking for cost for supplement plans, this here is what we use as our tracking. You would give us a call and you would tell us how old you are, and we would then send you this sheet that says this is what all the plans are. If you're 65 or if you're 68 or whatever you're at that particular time, if you're a man or a woman, the cost is different. And these are all, if they have money amounts in the column, then that carrier sells that particular policy. So this is one of the services that we offer to individuals, that you can give us a call, or you can go on the New Hampshire Insurance Department website, and the information is listed on there about all of the supplement plans that are on there. But oftentimes people will call us because it's much easier to call, and we'll send you what we refer to as our new to Medicare packet. And it has everything in it that you should need to know about Medicare. And then when you get it, if you don't understand any of it, you can always set up a Zoom meeting or a phone call to go over various things when it comes to supplements. So this is like what we would send you out to look at the various cost for the plans that you're looking for. In regards to supplement insurance, only within the first 6 months of eligibility to your Medicare can they not look at any pre-existing conditions. Once you're beyond that 6-month window, you're then subject to medical underwriting. You have to have Medicare Part A and Part B in order to have a supplement insurance. So it's only if you took Medicare Part A now when you're 65, and you're going to continue to work until you're 68, and then you're going to pick up the Part B, then that's when that would start, is when you have the A and the B, is when the 6-month window starts. So not when you're eligible for your A and now you can't get a supplement insurance. So people oftentimes will say, well, can I shop for supplement insurance on a yearly basis to see if there's a better plan for me, if there's not a better plan for me? When it comes to supplement insurance, all of the plans are issued aged. So if you're 65 today and when you're 70, you want to see if there's a cheaper option or whatever, you want to go from Plan N to Plan G because your health is declining or whatever might be happening in your life, you're then subject to medical underwriting because Medicare beneficiaries are not protected by the pre-existing condition clause. So you would be subject to medical underwriting, and you would be purchasing a plan at the age that you're at. So if you bought a plan at 65, you're now going to be writing a new policy at 70. So it would be the cost of how much it would be at 70, even though sometimes people might want to look from, same, right, even within the same carrier, it doesn't matter. If you're rewriting a new policy, you're subject to medical underwriting, and you are subject to that increased cost of the plan because it's now a new age that you're coming into that particular policy. So usually I will say, think long and hard about what you're going to look for when it comes to supplement plans, for that reason of the fact that the plans can look at your conditions later on. So if you want a comparison, you can always give us a call for that. Then they have what they refer to as Medicare Part C, which is also known as Medicare Advantage plans. Medicare Advantage plans are your A, B, and for the most part, D, all encompassed into one plan. When it comes to the Medicare Advantage plans, have your drug coverage attached with it. If I only can speak for Hillsborough County because I know what's available in our particular county, we have 34 Medicare Advantage plans that are available within Hillsborough County. And individuals have the ability to shop for those particular plans either by going on Medicare.gov or to give us a call. And we'd be more than happy to go on the Medicare.gov with you, create you an account, and see what might be. Most and foremost is that when it comes to Medicare Advantage plans, they're county and state specific. So you must stay within the network of providers, especially if you go with an HMO plan. If you go with a PPO plan, it does allow you the ability to go outside of the network, but you would have to pay higher copay amounts if you're outside of that particular network. When you go with the Medicare, the HMOs, you must get referrals from Dr. Smith to Dr. Jones. And even though that Dr. Smith is sending you to Dr. Jones, you do have to make sure that Dr. Jones is going to accept your insurance. So we run into that quite frequently, that individuals find that that their provider is sending them to a specialist and that specialist doesn't accept it. So you would have to go to one that did accept it. You do have the ability to look at Medicare Advantage plans, just like your Medicare Part D plans, during the open enrollment period, October 15th to December 7th. And then there is another enrollment period. So you might not have done your homework completely and you find that, oops, my doctor doesn't accept the insurance. So January to March, to the end of March, you have the ability to go back to original Medicare and pick up a prescription drug plan again, or go to another Medicare Advantage plan within. In the state of New Hampshire, we only have one 5-star plan. So an individual could come on or off of that plan if they so chose. That is with Martin's Point. So we only have one 5-star plan that gives you the ability to make any changes throughout the year, even outside of the open enrollment time of the January to March. So people can then go back to original Medicare or go from an Advantage plan to an Advantage plan. If you decided that you were going to go from original Medicare with a supplement to an Advantage plan, and now you say, I'm not really sure that was the best choice for me, you can always call your supplement carrier and see if they will take you back. Most of the time, they do take you back without looking at any pre-existing conditions if you stay within the same carrier. If you choose to go outside of that particular carrier, you could potentially be subject to that medical underwriting. So at ServiceLink, we are not only the SHIP, we are also known as the SMP, the Senior Medicare Patrol. So we help individuals if they run into any fraud, abuse, or cases that, just are errors, things of that nature. So we will help individuals to contact their their providers. An example, I had a gentleman last week who called and he said, I received a bill for over $5,000 from a hospital, and I shouldn't have received that because I have the Quimby program. So earlier I said the Quimby program paid the Medicare Part B premium, co-pays, co-insurance, and deductibles. So when I called this particular provider to question why the individual got the bill for over $5,000, I was informed that they were not aware that co-insurance was part of that particular program. So it was became just an education to educate them about, yes, indeed it does, and to bill accordingly so therefore they can get paid for it. I think the provider might be out of luck because it is outside of the timely filing. So they're probably going to have to just write off that bill because they didn't know that they needed to pay that the co-insurance was part of that particular program. So in that case, we refer this particular client of mine, we report it in our reporting system that says, oops, we saved him over $5,000 technically because the provider billed incorrectly and was billing him and has sent him to collections. But we encourage individuals to review your Medicare summary notice or your EOB that you get from your Medicare Advantage plan to make sure that indeed the services are happening to you and not someone else, because sometimes when it comes to Medicare benefits, you can only get them so many times within year or 2 years, and you don't want that to happen to you, that you potentially need to have something and you can't because somebody else already had it. So don't just assume that because you didn't get a bill from Dr. Smith or Jones or your local hospital that everything's covered. Oh, I have Medicare, I have my supplement, or I have my retirement plan. I didn't get a bill. It's all good. Go over your Medicare summary notice or your EOB. When I go to the doctors or hospitals, I make sure I check my EOB very closely to make sure that what's been covered, what's not covered, and who and what the cost of particular is. So again, make sure that you protect things such as your Medicare card, even though your Social Security number is not on the card any longer. When Medicare changed the numbers to the Medicare identification, people were getting called frequently. Oh, did you get your new Medicare card? Oh, no, I didn't. Well, if you just give me your Social Security number, I will tell you where your card is. Or in New Hampshire, we don't have a great deal of individuals that we deal with about fraud and abuse. Mostly our cases come down to things such as errors, like I was referring to, or durable medical equipment. About a year ago, we had that they were sending out back braces or knee braces to individuals. And every time you answer the phone and they say like Mary Smith and you say yes, well, you just said yes, that you wanted that back brace. So they record you saying yes, and then they send it to you. But you didn't really say, yes, you wanted that back brace. You were just responding to, you were Mary Smith. Those are the kind of things that we try to educate individuals about, like not answering the phone and saying like Mary Smith, yes, something else besides that. Because if you basically gave them permission. So again, to protect your information, detect if anything is wrong, such as the case I told you earlier. He detected that he got a bill and there was something wrong. So he contacted us for assistance. Report it. So you can report it either to an individual such as myself, your Medicare contractor, the Office of Inspector General, your local police department, whoever that you feel. Again, ServiceLink is here. We are here Monday through Friday. There is a toll-free number at the 1-866-634-9412. If you live in the Hillsborough County area, it would truncate you right here to this office. If you lived in Dover, it would send you to our Rochester office. If you lived in Laconia, it would send you to the Belknap County office. So wherever you live in the state of New Hampshire, it would go to your appropriate office. If you do not live in the state of New Hampshire, which I know Kim had put something earlier about where are you from? Every state has their own Aging and Disability Resource Center, and every state does have a SHIP. So New Hampshire is called SHIP. If you live in Massachusetts, they call it the Shine. But if you flip over your Medicare and U-Book, the phone number to your local Medicare office is right on that particular book. If you do not know where it's at, if you just Googled your state health insurance assistance program office, it's going to give you who your, because ServiceLink is specific to New Hampshire. Again, at the beginning, I said that I cannot tell you an individual if something is covered by Medicare or not, or if you have specific questions about your Medicare itself, you would need to call 1-800-MEDICARE. If you have any questions about fraud or abuse, you would call the Inspector General's office. Are there any questions?
There are a few questions, yes. As you can imagine, we have about 11 open questions right now.
Okay.
But if you have a question you've been thinking about, please, now is the time, type it into the Q&A function. And while we're giving people a moment to do that, I'll just mention our next event coming up on May 18th, presented by Martin Pisani, who is the author of the popular book, Get Outside, The Fitness You Can't Get in a Gym. He's a local man, local to New Hampshire, and just brings a wonderful, different perspective to fitness and aging outdoors. So with that, we'll get to some questions here. So this person is turning 65 in June, still working. What advantage would it have to take Medicare instead of paying the employee health care? And she has an HSA that she's in now for a 6-month window. What happens to that money?
That's kind of a two-part question. So we'll answer the first part of it. So in regards to the taking Medicare versus your employer-based plan, that has to do with like what your deductibles and out-of-pocket costs are with your plan and how much it costs for that premium. So if you had a high deductible plan, oftentimes people would weigh out the pros and cons about what their monthly costs are with the plan that they work with, and also what the deductible is with their plan, and then determine if going just straight on Medicare with a supplement prescription drug plan or a Medicare Advantage plan would be more cost effective for them. As far as the HSA part of the component, again, you have to stop contributing the 6 months prior to being eligible for Medicare. As where the money goes, I don't know a great deal about HSA accounts. So as long as you stop contributing to it the 6 months prior, you can still use that monies that you already have in your account. You could just no longer contribute any more monies to it.
Okay. So this next question pertains to 401k and other retirement plans. She's taking a minimum required distribution that puts her into a category that she has to pay, that the minimum amount annually. So she's wondering if there's kind of any insight into a way around paying that.
No, unfortunately not.
Right. Next question. Small business owner who supplies health insurance but has under 20 employees, will you be responsible for the employee contributions and paying for Part B? Or does that fall on the participant?
So if you are the owner of the company, you can agree to pay their, continue to pay their health insurance or not. So that's solely up to you as an individual, whether you want to continue to keep them insured by your company or not, or when they turn 65, that they have to go to Medicare. So if you're the owner of the company, it's up to your discretion on what you want to do. If you're not the owner of the company and it's less than 20 employees, then the owner of the company can tell you, no, you can no longer stay on our benefits, that you have to take the Medicare Part A or B.
Okay, that's helpful. Any special actions we need to consider when moving from an HMO?
I'm not understanding that.
Well, I think they're looking. If I'm reading this correctly, they're going to change from an HMO to a Medicare plan. So
if we're talking
to Medicare,
if we're talking about private insurance to Medicare,
probably. If that's not it, please clarify.
If we're talking about moving from a private insurance HMO plan to Medicare, your HMO plan, which you have through your employer, is kind of similar to like what you would have if you went with a Medicare Advantage plan HMO, that you pay the copays, deductibles, and you have to get referrals to Dr. Smith, to Dr. Jones, things of that nature. If you're going from your employer-based plan, which is an HMO, to original Medicare, there is no in-network, out-of-network for benefits. You can go to any provider that accepts Medicare, whether it's here in New Hampshire, whether you need to go have services in Florida, wherever that you need to. When you have original Medicare, it allows you the ability to go much broader than when you have a Medicare Advantage plan, so those are county and state specific.
Okay. Now, does Medicare pay for online office visits?
They do.
Perfect.
So, I mean, it falls under the same criteria of the office. They will bill your insurance the same way. You would have to pay the 20% of the cost of that procedure. It's not covered 100%.
Okay.
So it's like if you went to see the doctor face-to-face and it was $80, you would have to pay the 20% of that $80.
Okay.
Mm-hmm.
Okay. So there is a question about Riverwoods. So you get a break for a second here, Michelle. This question is, does the Riverwoods community require a medical exam? And are there certain illnesses that disqualify a resident for reasons? So the answer to that is that there are two elements of entry for our communities. There is a medical exam and there is a financial qualification piece also. And so our medical assessment piece really just kind of ensures that people can live independently and safely on their own. So there is a short physical assessment piece and also a cognitive assessment piece. But we do not disqualify people for pre-existing conditions. If it's a managed condition and you're able to live safely and independently, then you're welcome to live at a Riverwoods community. So that's the answer. I was so excited to have a Riverwoods question. Okay, so this person is on Medigap or has a Medigap plan and needs to understand the advantages of the Advantage plan. And can they switch to Advantage if it's more advantageous?
So again, the difference between the Medicare Advantage and the Medicare Supplement, Medigap, is that when you have a supplement insurance, you can go anywhere you want that accepts your Medicare. So again, there's no in-network, out-of-network for your coverage. When you switch to a Medicare Advantage plan, the only time that you can do that is during the open enrollment period, which is the October 15th to December 7th is when you have an opportunity to look at that as well. But again, keep in mind that if you didn't like the Medicare Advantage plan, you had a pre-existing condition, going back to the supplement plan that you had, your carrier could potentially say yes or no, whether they would let you come back, or if they let you come back, they could adjust the premium accordingly to your pre-existing condition, because they are all private companies.
Okay. So it seems like a little bit of, Medicare jargon here. So you might understand this more than me, but it says, what are the PTB charges that show up on EOBs? And I think an EOB is an explanation of benefits. I know that much, but
the PTB
charges, yes.
I have no idea.
Okay. Maybe if this person could clarify.
I don't do anything with billing or coding usually.
Oh, yeah. Okay. So maybe follow up. Is there a resource at ServiceLink that maybe could answer that question? Someone who's kind of specializes in billing, or no? Okay.
Anyone who does billing here, no.
Okay. Sorry, anonymous attendee. Let's see. How is SMP related to Medicaid Fraud Control Unit of the Office of the Attorney General?
So the SMP is specific to the Medicare piece. So because we are in New Hampshire, we are the ADRC, so we do all components, whether it's Medicare or Medicaid. So we are your SHIP, your SMP, your fraud for Medicaid, all of those components. In other states, their programs are kind of something like Massachusetts, if you will, because theirs are all separate. New Hampshire, we're lucky that we have everything together, housed right here. So we help individuals, but there's the SMP is specific to Medicare and the other is specific to Medicaid.
Okay, gotcha. So if you're moving to New Hampshire from another state and you start Medicare, when do you need to switch your coverage?
So when you move from another state to New Hampshire, they give you 63 days once you have developed residency to make any changes. So once you notify the Social Security Administration regarding your change, you want to make sure that you're going to be looking and having an idea of what you're looking for in the state that you're going to. Oftentimes what people will do is they will kind of not report it right away to the Social Security office, so they have the ability to move and make the necessary changes. But once you make the necessary changes, you change your address at 63 days. Everything goes into effect the first of every month. So even though they give you 63 days, if it goes beyond that time frame, so I would say try to make sure you make your decisions as soon as possible, so you don't have any lapse of coverage. Because if you have a Medicare Advantage plan, a prescription drug plan with Medicare, and what happens is once you change your address with Social Security, then your plan itself is notified that you have moved outside of their coverage area. And then that's when they will tell you that your coverage is ending or it ended. So it's really important. If you have a supplement insurance, the supplement insurance can travel with you. So you don't need to change your supplement insurance because you're moving to New Hampshire. Your supplement insurance would just come right here with you. So you just need to notify Social Security in regards to the address change, so your benefits can go to wherever you needed them to go now. Your Medicare is a federal program, so you don't make any changes to your A and B. The change would only encompass your D benefit or your Medicare Advantage.
Okay, great. This person is asking about, she says there's been a lot of advertising for Medicare Advantage. Is this better or worse than traditional Medicare, in your opinion?
So, well, because I'm not a licensed insurance agent, I can't give you my opinion. And the law prohibits me from telling you or saying anything in regards to what is better or what's not. When it comes to Medicare Advantage versus Medicare Supplement, it really depends on your personal needs. Economically, with a Medicare Supplement insurance, they're much more expensive than a Medicare Advantage plan. Some of the Medicare Advantage plans don't even cost you any additional money other than your Medicare Part B premium. It really depends on what you're looking for about seeing any provider that you want to see. So if you see a cardiologist in Boston and you have a supplement insurance, you know that you can go see that cardiologist in Boston. If you have a Medicare Advantage plan, you must make sure that that cardiologist in Boston is part of that particular plan. The big thing that we tend to run into, or that we find is the obstacle when it comes to Medicare Advantage plans, is if an individual goes into a skilled nursing facility, that the number of skilled nursing facilities that accept Medicare Advantage plan are limited. So where if you have a supplement insurance, you can go to any skilled nursing facility that has a bed available. With Medicare Advantage, we find some pushback in regards to the skilled nursing facility. With Medicare Advantage plans, they do have a couple of the extra bells and whistles, like the dental, vision, and hearing, depending on the particular plan, where original Medicare does not have dental, vision, and hearing at this particular time. They are in the process of working on that, but it's not been implemented into the Medicare system as of yet.
Okay, great. And there's one last question. It's kind of a scenario question. If you have Medicare and have signed up for Part A and B, but not yet for D, and you accepted a Medicare Advantage plan before the deadline for Part D, will you be penalized for not signing up for Part D in the future? Or if you go back to regular Medicare later?
So if you have a Medicare Advantage plan that has drug coverage attached with it, then there is no penalty because that's your A, B, and D all together. If you took a Medicare Advantage plan that only had the A and the B portion of it and not the D portion, and you want to then later on take a D plan, the answer is yes, you would have a penalty because you would need to have some kind of component to your prescriptions, whether it had to be something creditable. So sometimes we run into people who they might be covered by their employer's benefits or something of that nature, and they want to take a Medicare Advantage plan instead of having the Medicare, original Medicare itself. Not many people do that, so they'll take the one that just has the Medicare Advantage and not the drug benefits attached because they have drug benefits somewhere else. That's okay as long as it's creditable. So it has to be a creditable plan in order to avoid any type of penalty.
Okay, that's great advice too. So last call for any questions. And Michelle, I'll just ask you to forward to the last slide. Just has some contact information for Riverwoods. If anybody was interested in following up, we do have one more question that came in. And it asks, if you elect A, but are still working and covered under a company plan, when you lose the company plan, will there be penalty for Part D?
No, there is not any penalty for B or D as long as you've been actively working either your own company's plan or your significant other's plan.
Okay. It is very complex.
It definitely is.
There's a lot of little pieces here. And everybody, thank you so much for all of these great questions. We really hope that it was provided some great information for everyone. And, in addition to resource links, if you have, ongoing questions, ServiceLink is, a great provider that can answer a lot of these questions. So it looks like there's no one else submitted any other questions. So with that, I'll thank you for your time today, Michelle. And thank you everyone for taking time to attend. And hopefully we'll see you again at another workshop soon.
Thank you.